Okay, my project was continuous quality improvement in an optometry office. So a little bit of background on this. My dad has been an optometrist for almost 20 years. In high school, I worked at his office during the weekends and after school. My duties mostly consisted of cleaning and reorganizing the glasses and contacts after hours to ensure that everything was organized and ready to go for the next day of work. I became very familiar with the way that these were organized, and as I got older, my younger brother took over the cleaning duties, and I became more of a pre-test technician. And even after I graduated from high school and moved away to college, for 2 summers, I lived at home. So I even worked during those summers. From this job, I learned a lot about the different prescriptions of glasses and contacts, and that it's actually very complicated science. When my dad decided to relocate his office to a bigger building, I was able to help out a lot in the reorganization of the glasses and contacts because I had become so familiar with them. So, contact lenses and eyewear have much variety. There is not a one size fits all for each patient. Contact lenses come in an enormous amount of prescriptions as well as brands and types. Glasses also come in a variety of sizes, shapes, colors, and brands. So the goal of this project was to be able to organize the contact lens room and the glasses displays in such a way that would promote an effective work environment as well as an aesthetic feel that would coincide with the office. So this study aimed to focus on an effective workplace environment to promote efficiency and eliminate clutter and disorganization. In optometry, as well as many other medical professions, each patient requires different wants and needs. After the patients were finished with their exams, they were given their prescription, and based on their prescription, they could decide if they wanted glasses or contact lenses or both. Depending on what their prescription was, could help determine what contacts would be best for them. Because of the different variables and varieties of contact lenses, the room needed to be organized to be able to efficiently find the correct contact lenses for each patient. Similar concerns were involved in choosing glasses as well. There's a variety of shapes, sizes, and brands and styles to choose from. So it's important that not only they work for the patient, but that they like them and that they fit properly to their unique head and face shape. So the goal was to be able to organize the glasses in the office by brand, gender, and size to make it easier for the patients to find the contacts and glasses that would work well for them. So contact lenses, the process began by dividing them into groups by brand, because most insurances will only cover a specific brand or a couple different brands, so we need to be able to organize them that way first. Then they are split into subgroups. There are soft contact lenses, which are made of soft, flexible plastics that allow for oxygen to pass through the cornea more easily. Soft contacts may be easier to adjust, and they're often more comfortable than the rigid contact lenses. The rigid contact lenses are more durable and resistant to deposit buildup. They generally give a little bit of a clearer vision depending on the patient. They're usually less expensive because they last a little bit longer than soft contacts. However, they are less comfortable. There are also daily contact lenses, which can be ordered in months or year supplies, and there are also contacts that are specifically made for patients with astigmatism, which is an abnormal curvature of the eye. My husband has pretty bad astigmatism, so it was a challenge finding contacts that worked well for his eye because of the uniqueness of them. So we need to be able to organize them well for that scenario as well. Glasses can be a little trickier than you might think that they are. Each pair of glasses comes with a number printed on the inside of the temple. This number is associated with the lens width, the bridge width, and the temple length. In order to know which fit is best for the patient, the technician can actually take these measurements, and that makes it a little bit easier to find glasses that will fit that patient. Although the fit is a very big factor, there are other big factors that should be considered when the patient is choosing their glasses, such as what insurance they have. That can also affect what glasses they are covering, as well as how they look. Usually they're split into genders. So we would put the male side, the male glasses on one side and the female glasses on the other, and then the ones that are more unisex in the middle. And then there's also a section of kids' glasses that makes that a little bit easier because they're a little bit cheaper and smaller for children. So the outcomes, the objective of this project was to facilitate organization and efficiency throughout the office. We wanted the patients to have an easy experience finding glasses and contacts that worked well for them, given all the factors that are involved in choosing them. We also wanted the doctor to be able to find the correct contact lenses for his patients very easily. Overall, the project was carried out very well. The contact lens room was organized first by brand, then it was broken down into categories such as soft or hard contacts or contacts specifically for astigmatism. Contact lenses also come in both positive and negative prescriptions, depending on if the patient is near or farsighted. Lastly, the contacts were organized by prescription, starting with the smallest prescription up to the largest. Not only did this make it easier in finding contacts initially, but it also made it a lot easier to restock quickly and effectively and to be able to see what needed to be restocked. The glass displays were first organized by category as well. They are organized by men, women, unisex, and children's glasses. They all had a designated spot in the display room. Each category of glasses were then displayed by shape, color, and price. This made finding the glasses for each patient a lot easier. The objective of this project was met well as the desired outcomes. It improved the efficiency of the workplace by creating a smooth flow of patients and organized the work environment. We have also found that if the workplace is organized and effective, that makes the employees as well as the patients a lot happier and have a better experience. So this project was a really great learning experience. With many big organization projects, there could be quite a bit of trial and error. This is the case because there are a lot of factors that need to be considered. It does take time to figure out the best way to get everything organized in the most efficient way possible. So it's really important to have a good plan and write out exactly what you're doing and where each item should go. It's important to make the most of your time and not waste your time. Another factor that had to be taken into account is the aesthetic of the office. Not only do we want to organize, but we also wanted it to look good and coordinate with the rest of the office. Sometimes that can be hard to find a good balance. So again, trial and error can occur. That's just part of the process. Having a plan is really important in the beginning. This project was very successful. It did make the overall aesthetic of the office look better and the efficiency was better. It was more productive. There are always improvements that can be made throughout time as patients buy products and we have to restock and new shipments come in of different contacts and glasses. However, because things were organized so well in the beginning, that will make it more efficient in the future. This project, although it was very specific for this scenario and this office, it can be implemented in many different aspects. The process of making a plan and breaking it down into categories and then organizing and reorganizing until it is satisfied and efficient can be successful for a number of different projects. This was very successful and it definitely had a positive effect on this office. The organization did make a big difference and the aesthetic feel was very nice, so we are very pleased with how it turned out.